Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is right coronary artery, free medical education. Normally, human heart is supplied by two coronary arteries, right and left. They are vasa vasorum, the small vessels supplying the thick walls of the blood vessels and the heart. The name coronary derives from the Latin word coronarius, means encircling in the manner of a crown. Two coronary arteries arise from the aortic sinuses. What are the aortic sinuses? The aortic sinuses are three small outward dilatations or bulges at the root of the ascending aorta just above the aortic opening. Each sinus is opposite to the respective semilunar cups leaflet of aortic valves. Let's see the diagram. This is arch of aorta. This is ascending aorta. This part is the root of the ascending aorta just above the aortic opening. We have three bulges there called aortic sinuses. If you see the cross section of the aortic sinuses, one sinus is in front, we call anterior aortic sinus. Two sinuses are behind. One is on the right side, called right posterior aortic sinus. Another one is on the left side, called left posterior aortic sinus. We are showing two diagrams in this slide, A and B. Both are seen from above, superior view. In diagram A, this is aortic opening. In front and slightly to its left is pulmonary opening. In the aortic opening, as we have mentioned earlier, we have three aortic sinuses, one anterior, two posterior, right posterior, and left posterior aortic sinuses. We are going to see the same sinuses in diagram B. This is anterior aortic sinus. This is right posterior aortic sinus. This is left posterior aortic sinus. This is right coronary artery. This is left coronary artery. Right coronary artery arises from anterior aortic sinus. Thus, anterior aortic sinus is also known as right coronary sinus. Left coronary artery arises from left posterior aortic sinus. Because of that, left posterior aortic sinus is also known as left coronary sinus. However, no artery arises from the right posterior aortic sinus, RP. No arteries come from there. Because of that, right posterior aortic sinus is known as non-coronary sinus. The coronary arteries which are filled with blood during ventricular diastole, not like other arteries in the body. Grooves, sulci of the heart. Single we call sulcus. The cavity of the heart is divided by internal partitions into four chambers, two atria and two ventricles. Lines of attachments of the partition to the wall of the heart produce the grooves sulci on the external surface of the heart. The groove that demarcates two atria from the ventricles is atrioventricular groove. It has anterior and posterior segments. Here, two atria are presented here. Two ventricles are here. The groove which demarcates between the two atria and two ventricles is atrioventricular groove. This is anterior segment of the atrioventricular groove, and this is posterior segment of the atrioventricular groove. The groove that demarcates the two ventricles is interventricular groove. It also has anterior and posterior segments. This is two ventricles. This groove between the two ventricles is interventricular groove. It is anterior segment and this is posterior segment of the interventricular groove. The crus is a point where posterior atrioventricular groove and posterior interventricular groove cross on the inferior, that is diaphragmatic aspect of the heart. This is the point called crus where posterior atrioventricular groove and posterior interventricular groove cross on the posterior aspect, that is diaphragmatic aspect of the heart. This is an important point. Right coronary artery. This is schematic diagram of the heart seen from above. This is anterior, this is posterior, this is right, and this is left. This is aortic opening with three sinuses, anterior, right posterior, and left posterior sinuses. Anterior and slightly to the left of the aortic opening is pulmonary opening. Anterior to the aortic opening is right auricular appendage located above the right atrium. Left of the aortic opening is left auricular appendage sitting on the left atrium. Right of the aortic opening is right and atrioventricular opening guarded by three cups, tricuspid valves. Behind the aortic opening is left atrioventricular opening guarded by two cups, bicuspid or mitral valve. Now we are going to talk about the origin of the right coronary artery. This is the right coronary artery. As we have stated earlier, right coronary artery arises from the anterior aortic sinus, which is also called right coronary sinus. Course of the right coronary artery. Right coronary artery consists of two segments, first segment and the second segment. This is the first segment, which arises from the anterior aortic sinus and runs forward between pulmonary trunk, which is on its left, and right auricular appendage, which is on its right. So this is the right coronary artery, first branch, first segment, which is between the pulmonary trunk and right auricular appendage. Let's see the diagrams. This is the anterior view of the heart. This is pulmonary trunk. This is anterior aortic sinus. This is right atrium. This is right inferior border of the heart. This is atrioventricular groove, anterior atrioventricular groove. This is posterior atrioventricular groove. This is posterior interventricular groove. This is the point where the crus is. Let's continue the right coronary artery. The right coronary artery comes out from the aortic sinus, runs forward between pulmonary trunk and right atrium. It reaches to the anterior atrioventricular groove and runs almost vertically downwards along the right atrioventricular groove to reach to the right inferior border of the heart. Next is the second segment of the right coronary artery. This is the second segment of the right coronary artery. Right coronary artery winds around the right inferior border of the heart and runs along the posterior atrioventricular groove. Commonly, that is in about 60%, right coronary artery terminates little to the left of the crus. You can see here, commonly in 60%, right coronary artery will terminate little bit left of the crus. In this slide, we show 3 diagrams of the heart. That is, in this case, this is right inferior border of the heart. That's first point. And in this diagram, there is a point between the right inferior border of the heart and the crus. Between these 2 points, this is one. And in the third diagram, this is the left border of the heart. We are going to talk about the length of the second segment of the right coronary artery, which varies. Other than where it commonly, that is in 60%, terminates just beyond the crus, it may terminate A. In this picture, right coronary artery may terminate at the right inferior border of the heart, where it turns around in 10%. So right coronary artery may terminate here in 10%. Or between the right inferior border of the heart and the crus in another 10%. That means the point which is between the right inferior border of the heart and the crus. Here also the right coronary artery may terminate in another 10%. Or right coronary artery may go beyond this and along the posterior atrioventricular groove or sulcus reach up to the left border of the heart, and there it may terminate. That is in 20%. Branches of the right coronary artery. For descriptive purpose, branches of the right coronary artery are divided into 2 groups. First, branches from the first segment, and second, branches from the second segment of the right coronary artery. There are several variations in the sequences, patterns, and distributions of the branches. The first group, branches from the first segment of the right coronary artery. The first one is right conus branch. The second, sinuatrial SA nodal branch, which may arise from the right anterior atrial artery. The third, right anterior atrial artery, which often gives sinuatrial branch. Fourth, anterior ventricular branches. Fifth, right marginal branches. From the second group, that is the second segments of the right coronary artery, the first one is posterior atrial branches. The second, posterior ventricular branches. The third, posterior interventricular, that is right posterior descending RPD branches in the 85% of the cases. This is anterior view of the heart. This is anterior aortic sinus. This is right coronary artery coming down along the anterior atrioventricular groove, reaching up to the right inferior border of the heart. So this is the first segment of the right coronary artery. Now let's talk about branches from the first segment of the right coronary artery. Very first one is right conus branch. This is the one, right conus branch. The second is SA nodal branch. This is the SA nodal branch, which often arises from main right coronary artery or from the anterior right atrial artery. Third one is anterior right atrial artery. This is the one which may give SA nodal artery. The fourth one is anterior ventricular artery. This is the one supplying the anterior surface of the ventricle. And the fifth one is right marginal branch, which runs along the right margin of the heart, may reach up to the apex of the heart. This is the posterior view of the heart. This is left atrium. This is left ventricle. This is right atrium, and this is right ventricle. This is posterior atrioventricular groove, and here will be the crus. Okay, then what are the branches from the second segment of the right coronary artery? Before we talk about the branches, let's see, this is actually right coronary artery on anterior surface of the heart, coming down to the right inferior border of the heart, turn around and go along the posterior atrioventricular groove, and this artery will go across the crus, and just after the crus it will terminate. And what are the branches given by this second segment, that is the posterior part of the right coronary artery? Very first one is posterior atrial branch, that is supplying to the back of the atrium. Second one is posterior ventricular branches, supplying to the back of the right ventricle. The third one is posterior interventricular branch, which is the biggest one, also called right posterior descending RPD, along the posterior interventricular groove. And you may have coming from here, that is from the second segment of the right coronary artery, supplying to the atrioventricular node. This the AV nodal branch is coming from the second segment of the right coronary artery. Sinuatrial SA node, atrioventricular AV node, and atrioventricular AV bundle. They are specialized type of cardiac muscle and not nerve tissue. Let's see the diagram first. This is superior vena cava. This is superior vena cava opening. This is SA node. We are opening the right atrium. Inside the right atrium, if you see on its right wall, there is a crest there inside, called crista terminalis. Outside the crista terminalis is a groove there called sulcus terminalis. Okay, let's go back to the histology or layers of the heart muscles. I hope you remember the visceral layer of serous pericardium is also known as epicardium. It covers the myocardium. Deep to the epicardium is subepicardial layer. So now, where is sinuatrial SA node? The SA node is situated in the subepicardial layer of the anterolateral wall of the right atrium, just below the opening of the superior vena cava, and at the top of the sulcus terminalis. So this is the SA node. It is in the subepicardial layer on the anterolateral wall of the right atrium, below the opening of the superior vena cava, at the top of the sulcus terminalis. This is the interatrial septum between the right atrium and left atrium. Now let's talk about atrioventricular AV node. It is situated in the interatrial septum of the right atrium. On the right atrium, interatrial septum, exactly in the triangle of Koch. This is the one. AV bundle is in fact extension of the AV node. The arterial supply of the SA node, AV node and AV bundle derived mostly from the right coronary artery. Structures of the heart supplied by right coronary artery. This is the diagram showing cross sections of two atria, right atrium and left atrium. This is interatrial septum. And cross section of the two ventricles. This is right ventricle and this is left ventricle. This is interventricular septum. This is SA node and this is AV node related to the right atrium. This is right coronary artery going around the atrioventricular groove. Now, what are the structures of the heart supplied by right coronary artery? Very firstly, entire right atrium. This is the one, entire right atrium. Almost entire right ventricle. Almost entire right ventricle, which includes inferior 1/3 of the interventricular septum. A strip on the inferior surface of the left ventricle, but this right coronary artery does not supply upper 2/3 of the interventricular septum and anterior surface of the right ventricle, little strip next to the anterior interventricular groove. This little part and this little parts are not supplied by the right coronary artery. They are supplied by left anterior descending from the left coronary artery. Next is sinusatrial node, SA node, supplied by right coronary artery in 65%. Atrioventricular AV node in 80 to 90%. Atrioventricular bundle will be continuation here. That will be right half, and then right bundle branch. This is the right bundle branch, which is supplied by the right coronary artery, and then this is right ventricular papillary muscles. All are supplied by the right coronary artery. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. Please see Anatomy DAHAR series, Coronary Arteries Applied Anatomy. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.